but also please do type in your questions in the chat, because we have our whole team from our Orange County schools. They are in the background ready to answer any of your questions that you have. And we will also be creating an FAQ of the questions presented at our 2 presentations, and we will be sharing that with you as well. So, and I believe Ms. Blefko let our families know that for the Spanish, you can also type it in Spanish in chat, and we'll be able to answer.
Sí, para las familias que hablan español, ustedes pueden escribir en el chat y podremos responder sus preguntas. Desafortunadamente, nuestro sistema no está funcionando para la interpretación en español, pero pueden escribir sus preguntas y con mucho gusto las responderemos.
Gracias. So families, our aim has always been to safely bring our students and our staff back to school. When all of this started, that has always been our aim, because we know the true value in in-person teaching and learning, and for the overall development of our children. And so as we get ready to do so, we would like to share with you our health and safety guidelines that we have in place to make sure that your child and our staff are safe. And before we do get started, while Spanish interpretation we weren't able to get working right tonight, we do have some other languages that are available for interpretive services. So just real quick, if you are on your computer, you'll see that on the right hand corner, towards the corner, you'll see an interpretation icon, and if you click on that, a drop-down menu will come giving you options of the language that you would prefer to hear the presentation. And then once you click on that, then you have the option to turn off the English version, because if you don't want to hear me and you just want to hear it in your home language, of course, you can turn me off. And then you click again the language that you've selected, and that should take you to your interpretive services. Similarly, on your mobile phone, on the right-hand corner, you can also click there and you will receive your drop-down menu, and you select language interpretation. Your languages should pop up. You select your language, and then again, you can mute the original audio, and then you can select your language, and we should be good to go. So our aim by the end of this evening's presentation, you'll have received information about the district's safety processes and protocols that will be followed. And you will have engaged with our doctors from the ABC Science Collaborative regarding COVID-19 and schools. So let's get started. Safe, healthy, and learning. That is our aim, right? And so we do have a safety plan in place, and we need your help to keep yourself and others safe. We must follow these protocols before we even leave the home. So we want to check for our children before they leave the house to check, do they have a fever? Have they been in close contact with anyone that has COVID? Does your child have any COVID symptoms? Or has your child or anyone in your household been diagnosed with COVID? So there are a set of questions that we are going to have you ask yourself and of your children before you leave for school to ensure that everyone is safe. And so here are the questions. Do you have a fever? And we'll want you to take a temperature check, right? And then, have you had close contact in the last 14 days with someone diagnosed with COVID-19? And what we mean by close contact, that means that you've been within 6 feet of someone for at least 15 minutes. And that's what we mean by close contact. But also, has your child or anyone in your household have a healthcare provider that has been contacting you to let you know that you need to quarantine? That's the second question. The third question, are you experiencing any symptoms of COVID-19? And some of these symptoms are fever, chills, shortness of breath, or difficulty breathing, a new cough, maybe a new loss of taste or smell. And then our fourth question, have you been diagnosed with COVID-19 since you were last at school? So these are the 4 questions that we need our families to ask of their children before leaving the house. And when you ask those questions, if you're saying no fever, no to questions 1 through 3, then we're saying that, you know what, there are no flags of concern and you are ready and you can go to school. But if you answer yes to any of those questions, then we're asking you to please stay home and then contact your doctor. And if you can't go to school because you've answered yes to any one of those questions, please call your principal, because there are a number of steps that we'll share with you in a little bit that the principal then takes to ensure the safety of everyone else that might have been near your child. And so let's walk through some steps, right? Because you're at home, here you go, your child, you know how it is in the morning, you're all running around getting ready. But before we leave the house, let's do that temperature check. And here is the parent or guardian taking a temperature check. And this needs to be done every morning, not just the first day of the week, but every morning. And then we want to make sure the child has the mask on before they leave the house. And when your child goes to the bus stop, what we're requiring is that a parent or a guardian be present with your child at the bus stop, because we need your help again to ensure that all students at the bus stop are practicing social distance, that they're keeping their mask on. And then once the bus comes, we will do another layer of screening just to ensure that everyone is safe. So before your child gets on the bus, there will be another temperature check. And as long as the temperature check is fine, your child will be able to get on the bus and sit socially distanced. But if there was a change from when you took the temperature of your child at the house and the temperature check at the bus stop, then we need you to be able to take your child back home. And that's one of the reasons why we're requesting that all students have a parent or guardian at the bus stop with them. The bus is cleaned and disinfected on a regular basis. The windows cracked open for fresh air intake. And on this picture, the kids look like they're sticking their heads out of the window, but no, that's just to show that there's going to be the window open for fresh air intake. And then some more precautions when the kids come to school. Again, socially distanced, may they be coming off the bus or car riders coming pulled up. So let's first talk about the bus riders. The bus riders, again, when they're getting off of the bus,
Girl, you can suck my dick.
another screen. So when they do
Don't try to beat me, bitch.
Okay, thank you. I had to unmute myself. So once your child's bus gets to the school, your school staff will be there to conduct another screening, because we're taking every precaution to make sure that your child and the staff in the building are going to be safe. So they will socially distance as they get off the bus. The school staff will be there to, again, do another temperature check, again, ask the questions of the students, and as long as they're clear, they will be able to go to class. If in that time that you made sure that your child was okay and got on the bus, and there was a change from that time to when they're getting off of the bus, then the child will be taken to a space near the nurse's station, and the nurse will be there to assess if the child does have a fever or any other symptoms. And if they're seeing that, okay, wait a minute, your child needs a little bit further care, then they will go to the care center, where the nurse can keep them safe from other people and do a more thorough check to ensure that they're safe. But if they're saying, you know what, your child ate too fast this morning, they just have a tummy ache, okay, then they're going to go to the nurse's office and, you know, maybe relax a minute, feel better, and then they can go back to class. But in the care center, if the nurse is finding that, no, you know what, these are symptoms that we need to have checked out, then they're going to call you and you're going to have to come and take your child home. And then when you take your child home, then follow up with your doctor, and they will let you know how you should proceed with next steps. So that's if you're coming off of the bus. If you're a car rider, as the cars come up, the school staff will do another screening, but you will not have your child get out of the car until the screening has been cleared. So you come up, your window will be rolled down, your child will put their head by the window, they'll take a temperature check, ask you those 3 questions, and as long as everything's okay, then they will be able to get out of the car and go to school. If it's not clear and they're not okay to come out of the car, then we're just going to ask that you take your child home. So that's like the 3rd layer of screening that we'll be conducting to ensure that your child is safe and ready to be able to come to school. So we spoke a little bit about the care center and when a child might go to the care center. And of course, throughout the day, your child might have been safe and okay to come in the morning, but maybe throughout the day, your child starts to not feel well. And when they go to the nurse's office and the nurse does a check and they see that, okay, wait a minute, these seem like COVID symptoms. So then they're going to go to the care center. And if it's not, then they will just go to the regular nurse's office, right? We're just trying to make sure we keep those who we think may be showing symptoms isolated from the others. And that's why we've created care centers in every single school. But it will be the nurses and their expertise that will gauge who needs to go to the care center and who's okay not to. Again, safety and disinfecting measures will be applied throughout the day and every day. So when it's time to go to class, nothing about this school year has been typical, right? But what will happen is just extra care. We're going to make sure that the face masks are on, that we're washing our hands for at least 20 seconds on a regular basis, and that we're socially distanced. And so that will become a part of our regular routine. And the kids are always, they're used to having routines and procedures in school, because just like they know to raise their hand when they want to speak, just like they know that, this is how we go to the restroom, walking down the hallway, that, they know they have these procedures. And so the teachers will practice and show the students what the new procedures will be. And they'll be practicing that throughout orientation when they come back for school. And then of course, practicing that every day as part of their new routine. And then for lunchtime, that might be a little bit different again, right? Oftentimes kids are used to going to the cafeteria, sitting right next to their friends and talking and eating and just, taking a break. So we're going to take our lunch breaks a little bit differently when we come back. And what'll happen is for some of our students, they will have meals delivered to their rooms and they will eat in their rooms, socially distanced, right? Some of our classes, especially some of our older students, high school students, they may actually go and get their food and then come back. But however we get our lunch, it will be done safely. It will be done socially distant. And when we're eating, we're used to talking and eating, even though we try to teach our kids, don't talk with your mouth full, it happens. But in this case, because we don't want our spray from our mouth to coming out, right? And now everyone's going to have their masks off because they're going to be eating. We don't want that spray. So we're saying, students, when you're eating, no talking, right? We're going to make sure that we keep our masks on, we prepare what we're going to eat, and we've already washed our hands and we're all set. Then we're going to take the masks off. Then we're going to eat, and not eating too fast, but eating within a 15-minute window. No talking, because we just want to focus on eating. Once we're done, we're going to clean up everything, wash our hands, put our masks back on, and then we can socialize and hang out with our friends again, socially distant, with our masks on. And we'll have already washed our hands and we'll be clean. So those are some of the changes that will happen when we return back to school. But you know, recess, who doesn't love recess? That will still happen. We'll just make sure that we still have our masks on and that we're going out and still having free time. And that's for all ages, right? High school students, you know, they might not call it recess, but they love their breaks, and there will be opportunities for breaks. There will be opportunities for mask breaks as well, but the teachers will do that in a way that is safe and socially distant, where we don't have to worry about the aerosol like spray from our speaking coming in contact with our peers. And then when it's time to go home, it's a similar process, right? There's always dismissal protocols that every school has. And when we dismiss, we will do so in smaller groups to allow for social distancing. We will make sure that the masks stay on and that everyone gets home safe. So, you know, we're bound, someone is bound to have, you know, tested positive or come in contact with someone who has, or there might be some presumptive cases. That's just bound to happen, right? Because it's a virus, and, you know, there's no guarantee that's going to be 100% no one getting it, because that's why we're in the situation. It's a virus and people get sick. And we're going to take every caution to not get sick. But should we get sick, what we are asking our families to do is please call your principal as soon as you find out. It could be in the evening, it could be on the weekend, but as soon as you find out and as soon as you tell the principal will notify, you know, the nurse, and then there's a whole chain of communication that takes place after that, because we want to make sure if this is the student, number one, you're all going to, the students in that class, right? You will receive a phone call, because, you know, we want you to know, yes, there was someone in your class that has been tested positive. And so then there will be directions, like there's been someone in your class, you'll receive a message, but you're okay, right? You're going to be okay. And if there are more steps that you need to take, then you're going to get another phone call from the Orange County Health Department, because that's part of their checking to what they're calling contact tracing. And they're going to be calling families to find out and better understand the situation, to know how to guide families on what steps they need to take next. Because some of us may need to quarantine, others may not. And they're the experts, and we're going to be working very closely with them, and they will let us know, do I have to take next steps, or this phone call was just letting me know. So if you get a Connect Ed call, it's not, don't be alarmed, you know, don't freak out, because then Orange County Health Department will follow up if there is a need for next steps. But that's why we ask you to call us right away, because then we're saying, okay, what's the classroom space? You know, we need to go in and we need to disinfect. Which buses was this child in? We need to make sure that the bus is disinfected and we're taking care of all of the necessary cleaning precautions to ensure that there is no further spread. And then, you know, oftentimes the question that comes up is, well, when will the school close, or when will the district close? And just so you know that what research is showing us, right, with a number of schools across the state of North Carolina and across the country, there have been schools that have been open and in Plan B since the beginning of the school year. And there's a lot of science and research. And that's why we have our doctors with us to share in a little bit. But that it's not just because someone got infected with COVID-19 that we need to shut down. That's not how this works. So each case we will look at case by case. We will work very closely with the Orange County Health Department. We will follow the guidance from our scientists and doctor experts. And then we will decide, is it that a classroom maybe needs to be relocated while we're cleaning? Maybe, you know, yes, a school might have to, because of, but there are many factors that we have to look into. So it's not a simple close or don't close. And again, it will depend on the extent and severity of the illness. It will, that will help us to determine, you know, it's part of a school or a whole school, and the superintendent has a team that she will be conferring with and collaborating with, right, to help make these decisions. And this team consists of Dr. Felder, our superintendent, myself, our lead nurses, our public information officer, our chief operating officer, our director of exceptional children's services, and then our director of environmental health and safety. And of course, the superintendent will always be in direct communication with the board to help make the decisions for the district. So that was a lot, but those are some of the protocols that we have in place for in preparation for our students to return back to in-person school starting January. And the families, you should have received an email for the Plan B sign up. And if you haven't, please contact your school, because that may mean that we don't have an email address for you. So you, in the sign up, will have the opportunity to select how you would like your child or children to come back to school in January. And that sign up is also due by November 23rd. So decision-making time is now, and we're really excited to have you back. But to share with us some more information about the science behind COVID-19 are three of our expert doctors that are here with us from the ABC Science Collaborative, and I know they're going to share more information with you about the collaborative. But tonight we are very fortunate to have Dr. Kanisha Zimmerman, Dr. Gabriela Maradiaga, and Dr. Ibukin Akinboyo with us tonight, and we've been very fortunate to be able to collaborate and with them and learn from them as we've had to make some tough decisions in the best interest of your safety. So with that said, I'm going to pass to Dr. Zimmerman. I think it's Dr. Zimmerman will speak first, and then we'll come back with more questions.
Thank you very much, Dr. Dawson.
And Dr. Maradiaga, yes.
Yeah, no worry. And thank you everyone for being here tonight. Muy buenas noches a todos. We are thrilled to be working together to help all of our communities stay safe, healthy, and get their education. Be safe at school, be safe at work, and be safe at home. We wanted to share a little bit about the ABC Science Collaborative and how we came to be. So, you know, a group of us got together with the idea that it is so important to make sure that we use data and science to really drive decision making so that we can do the best for the children based on the evidence that's out there. And this came about with Dr. Zimmerman, who's here tonight, and her colleague, Dr. Benjamin, in discussing how scientists go about other things in the hospitals. And so these committees form of experts in that field, and they look at all the evidence and they advise other doctors in the hospital about what to do. So things like how to choose a specific medicine for a specific disease. And they came up with the idea of an advisory board like this, where we could take all of the headlines that come out in the newspaper, all of the research articles, really study them and understand them and try to take from that what is useful for our children here in North Carolina. So the ABC Science Collaborative was born. You can go back to the last slide, please. Thank you. Is this program that is actually putting together scientists and doctors with schools and community leaders to help understand the most current and relevant information about COVID-19. And we are funded by the National Institutes of Health. And the members of our team, you saw three of us here, but really this is a big team of doctors and scientists, as well as administrators, communication experts, all sorts of folks with many different areas of expertise working together from the Duke School of Medicine, UNC School of Medicine, and the Duke Clinical Research Institute. So as we thought about the ideas that might come up, we know it's so important to listen and hear from our community to help us understand what the needs are and then see how we could be helpful. So the kinds of questions we've been hearing from parents are obviously about the children and how to keep them safe. A few of us are parents as well and community members. So this was born out of a need to be involved in our own community and in the care of our children. We come to this as doctors, but really first we come to it as community members, parents, and members of our local areas. Teachers, of course, how do I keep myself and the students safe? Principals thinking broadly about how do we help teachers and parents feel confident with being in school. And then, of course, the superintendents thinking about the broader learning environment and what we do if we do have COVID cases in our schools. And I will hand it off to Dr. Kanisha Zimmerman, who has been working tirelessly from the beginning to let you know a little bit more of the details of the structure of the ABC Science Collaborative.
Thanks so much, Gabby. So we do have 3 areas of focus. We had to kind of organize all of our thoughts and all of our desires here and make sure that we could deliver the information and deliver what communities really needed. The first is really education and learning. We wanted to share existing guidance about COVID-19, and we wanted to make sure that that guidance included information from the national level, from the state level, from local health departments, and we wanted to share that with school administrators and educators and staff and students and teachers and parents, really everyone who has interest in really learning more. The next is really informed decision making. So using data to drive decisions, using data from the local school district to help make decisions about what that specific school district should actually be doing. And then finally is generating new data. So how can we learn from this and learn what to do in the future? Next slide, please. So I'd love to turn it over to Dr. Akinboyo. Want to talk to you a little bit about what we've learned over the last several months in working with Drs. Dawson and Dr. Felder.
Thanks, Kanisha. So I'm going to go through a couple of slides just reviewing the science. And I think our role here is to show how the additional data that we've learned in the last couple of months, we know a lot more today than we knew in March when all of this started, at least in the United States. How the additional data points have been used to inform the protocols and the plans to accommodate for in-person, hybrid, even virtual, because we need to learn more about all of the transmission that can happen and where it can happen so it can inform our practices at home. So the next few slides are focused on some of the data around transmission, and we'll have some time at the end to review questions that are related to all of this. And so one of the key first steps is that all of the plans and protocols have to involve multiple steps. And the idea here is thinking about a Swiss cheese model where coronavirus is on one side and we are trying to have multiple protective barriers so that the holes don't align and lead to someone getting infected. And the barriers are things you've heard commonly. So ensuring that there's some kind of distance between kids and teachers or other educators. Ventilation, ensuring that you have a standard scheduled maintenance of the ventilation system. Not so much additional ways of ventilating a room, but making sure it's up to par with what's standard and can filter out the typical things that float around a room. Wearing masks, we cannot overemphasize that, wearing masks at school, but really wearing masks when you're interacting with anyone outside of your household, washing hands, and then we go into some of the additional things such as ensuring we can test and trace and cleaning the environment frequently. All of these together. So one intervention by itself may not be sufficient just by itself, but I think the addition of everything is successful, particularly in a school setting. Next slide, please. So how do we know these things work? If anyone has been in a salon, so getting your hair done recently, you know how closely you come in contact with the hairdresser. And this is a summary from the CDC. And I just want to mention that a lot of this, there are thousands of papers out there around COVID-19 and kids. We're not going to go through all of them. We're sort of doing a high-level overview of some of the key papers that have come out, and a few of them are summaries from the CDC and also alluding to our state guidance. And so bear with us as we go through all of this, but this was a summary from the CDC, and what they were looking at was what happened when 2 hairstylists who didn't know they were COVID positive ended up taking care of over 100 clients during their infectious period, so 139 clients. Everyone was wearing a face mask, both the hairstylists and their clients, and no one got infected. So just further proof that we know masking works. Next slide, please. And so when we take not just masking, sort of not focus on what's happening in childcare facilities. So over the last couple of months, a lot of our learning has come from daycares, camps, and childcare facilities, partially because schools were not open yet. And so this is another summary from the CDC, and this was trying to figure out what happened in Utah, where multiple different facilities saw a case and saw spread, and what potentially led to that. So I'm not going to go through every line on this table, but this table goes through 3 different facilities, and the red letters are what I want to highlight. So we looked through what their COVID precautions, the CDC looked through all of this. So what are the COVID precautions that were in place? And you'll notice that at least one facility did not require masking for staff. And then going down to the 3rd row, all 3 facilities didn't require masking for kids. And we know that children can wear masks. Yes, they may need to take a break here and there, but they can wear masks, and they can wear masks in a childcare setting, in a camp setting, in a school setting. They also were not meant to enforce distancing, and unfortunately, in all 3 facilities, the initial person that was COVID positive was an adult that came into that setting, and it led to spread. So the point from this, though, was what we've said all along, to make sure we're clear: children can get infected. There can be spread, but quite often, if children do get infected, it can be, so in this case, some of the kids that got infected did go home and infect others in their home. But when you look across the board, we've almost seen the opposite happen, where children are more likely to spread to each other than to spread to adults. And where we see cases within childcare settings, it's often an adult that brings it in. So campaigning with your social circles, ensuring that all the adults involved in childcare are practicing all the 3 W's and not coming to work while sick would be hugely helpful. But that was the take home here: children can get infected and can spread. Next slide, please. When you flip states, so we've had a natural experiment in the United States. We've had states sort of doing all sorts of different things. So we now have the ability to look at each state and almost try and learn from each state. So looking at a different state, this is Rhode Island. Again, the CDC went through and looked through their data in childcare settings, and they reviewed about 66 programs. And the goal here was they saw that over the summer, there were rising rates in local communities in Rhode Island, which led to cases in some of the childcare centers. But one key thing to the 3rd bullet point here is that while some programs had cases, so if you have cases in the community, you probably have a case or 2 in a school setting, because schools are just reflective of our communities. But in the childcare settings that had strict protocols, there were masking, distancing, and all of that, there was no secondary spread. And in the ones that had any secondary spread, so what that means is someone comes to school infected, or a childcare setting infected, and then infects someone else, it's usually because they were not adhering to protocols, which represented the 17 cases that they saw. So without going through all the details of the chart, the point was they saw some cases in people that attended daycare centers. They didn't see spread in most settings, and in the ones that they saw spread, it was because of a lack of compliance with a protocol. Next slide, please. And then taking a much broader view. So we've talked about, okay, what happens with protective measures? We know masking works, we know distancing works, and we know having protocols in place would work. When they are not in place, we've seen what happens with our natural experiment in the US. So if you have cases in the community, you have cases in schools. But then taking a step outside of the US, let's just click through the slides. So if you just go through 3 clicks, we've had the chance to watch other countries sort of have these things play out. So this first point here is looking at cases that occurred in China. This was also early on in the pandemic. There were 68 kids that they identified as infected, and 96% of them, so nearly all of them, had a prior adult contact. Next click, please. And then moving to Europe, so in France, again, somewhat earlier on in the course of the pandemic, schools were open. This child had multiple viruses. So those early letters mean one was COVID, child also had influenza and another virus, had a lot of contacts across 3 schools, and did not spread COVID, although managed to spread influenza. Next click, please. In Australia, again, schools were open at different points over during the course of the pandemic that we're still dealing with. multiple students and staff members that were infected across many schools and across many contacts, and only 2 secondary infections, so very few cases of spread, which leads to the main point. So next click, please, which is that as far as we can tell, cases can happen in schools, but in schools that are well prepared, SARS-CoV-2, the virus that causes COVID-19, it doesn't spread in schools, and maybe it doesn't spread as much in schools, and maybe less important in driving community spread than what we feared in March, where we thought schools were going to be the major drivers of this. We've learned more and more that there may be some spread, but we're not seeing massive spreads in schools. Next slide. And this article just kind of summarized exactly what I said, which is that in coming to the United States now. So we talked about what's happening globally. This is referring to data within the United States. This economist from Brown University has spent some time just pulling data together. And we're starting to learn, even in settings where it was questionable if schools should be open. So we've had some settings that opened schools because they opened everything. So some states just opened everything and schools happened to be opened, and cases where there were lots of cases in those communities, but opening of schools in those communities also did not lead to massive spread. And on the flip side, we've had communities that have kept schools closed and community rates have gone up and down, and it has not been linked to the opening and closing of schools. And that's what this data here is showing. So going to the third bullet here, when they actually parsed out over 200,000 kids across multiple states, they're finding about 1 infection over a 2-week period in a school of about 1,000 kids. Very low number of infections, and this did not spell out what's happening with spread, but very low additional cases, so secondary cases and spread. Next slide. And let's bring it back home. So what's happening in North Carolina? Thankfully, we're in a state that has done a good job in tracking and publicly reporting clusters within schools. So if you go on the NCDHHS site, the state's health department website, you can find out where clusters are. So usually if the school has 5 cases or more. We've done some additional work trying to identify if we're seeing spread within schools. And so we've worked closely with some school administrators across the state and looked at nearly 60,000 children and adults. Among those, we've seen primary infections. So I'm just going to repeat it, that if we have cases in the community, we may see cases amongst people that attend schools, that work in schools, that clean our schools, that run our buses. However, out of nearly 200 primary infections, there were only 8 secondary transmissions, only 8 cases that led to spread. And there were, at least so far in our early data, very early days, no child to adult transmission. So what does all this mean? I think it means that despite the sort of whack-a-mole approach we've seen in the United States, where some schools are opening high levels in communities with high levels of COVID-19, some schools are open in communities with low levels of COVID-19. One thing we've seen is that higher rates of COVID-19 in the community did not necessarily impact what was happening in schools. And if we follow the protocols in place, spread in schools will be extremely low. And I have to commend a lot of the school administrators, school staff, parents, teachers, students. I know some schools that have their students even joining in research projects to help with identifying cases and things like that. So schools have done a good job working to protect students and staff members. And this is just showing some of the cases that are available and where Orange falls in the cases per 100,000 population. So we'll pause here, and sorry, I may have gone a little bit fast, so hopefully that was somewhat easy to translate, but I'm more than happy to address questions around these. And all 3 of us have different roles in the hospital with how we take care of patients. And so we're more than happy to also just talk through COVID-19 infections and what that means for you and your child.
Thank you so much. That was a lot of information, but very, very important information. And I know that families have been putting questions in chat, and our team, they've been answering them. But I know that, some of the questions, like at other times that have come to, like the concern around, like smaller number of students or children being tested, and that the ones that are being tested are symptomatic. So then what about those who are asymptomatic? And should we be concerned about kids spreading it to our teachers or teachers spreading it to our students? Like, are these concerns that our parents should really be worried about?
Yeah, that's a great question. I'm going to paraphrase to make sure I address it all. So I think the initial question was trying to allude to the fact that are we missing cases because we're testing symptomatic kids? And we keep saying, well, kids may be asymptomatic for the most part, so we're just not finding all the cases. And I think that just addressing that first question is, yes, we may be missing some cases, but we've changed our testing strategies, particularly in North Carolina, when we're dealing with kids, where if they do have a defined exposure, even if they are asymptomatic, we have the ability to test them. So your local health department can help with that, your pediatrician, or one of the major health systems. So we are picking up on cases. And now when you come into the hospital for an overnight stay, a lot of hospitals have just kind of gone into testing everyone that's coming in, including kids. So we have a better sense of how much spread is happening in our community. Of course, kids do tend to have milder symptoms or maybe asymptomatic, so have no symptoms. And that may reflect the ability to spread this infection. So what we're seeing is when you have milder symptoms, you may have lower viral numbers in your nose and they tend to spread it less. So what can parents pay attention to and what do you need to know? I think in a prior year, you may have a child that has a mild cold and everyone just says, hunker down for a few days. It's probably fine, let it run its course. This year, we're probably erring on the side of at least getting them tested for COVID-19 and trying not to cloud out what's COVID, what's influenza. We do have a vaccine that's safe and effective for influenza. So ensuring that children are getting vaccinated against influenza so they also don't have something else that could confuse the picture.
Dr. Dawson, it's also one of the reasons that we want everyone to wear masks is because of the possibility of asymptomatic spread. But we know that whether you're symptomatic or asymptomatic, having masks on both, both the person who's infected and the person who's not infected decreases the risk for infection. So that's really why it's really important to adhere to these protocols.
Yeah. Yes. And one of the things that we've been, thank you for that, Dr. Zimmerman and Dr. Akinboyo. One of the things that we've also been sharing with our families and our staff is, in partnership with listening to our Orange County Health Department and listening to the guidance of the ABC Science Collaborative, that we're erring on the safe side and we're going slow, right? Like we're going slow. And I think sometimes while families and staff, they want to understand that, but they still want to be able to do things, like they want to be able to do sports or band and chorus. And so can you help us to better understand why it's really, really like important for us to go slow as we make decisions and returning it, to back in person?
I wasn't sure if one of my colleagues was going to jump in, but I think you hit the point when you were discussing the planned protocols for restarting in-person education. And some of it is the only way we can see if this is going to be successful is not trying to do everything at once. We've learned a lot over the last couple of months. We know which settings can be made safer. At the same time, we need to stand up first and then take a step, then walk before we start to run. And I use that analogy because it would apply to things, say sports, group activities, singing, using musical instruments, and just setting up policies around all of those. So we have protocols for safe activities. Starting and choosing when to start may depend on a few things. We try and keep the metrics to determine what happens in schools to use school-specific metrics. So what that means is using data that's coming from school children, from school settings that may be open in North Carolina as compared to just what's happening in our nation as a whole or in our state as a whole. And it suggests that starting with at least educating kids in person first, then increasing activities over time will help with a successful launch versus everything at the same time.
Great, excellent, thank you. I'm just trying to kind of scroll through some of our questions to ensure that we had some, if we didn't, make sure we didn't miss any. Okay. So, you know, it's one thing when we say it, but sometimes it's different when other people say it. But what is the most important thing that we can do to keep ourselves and other people safe?
I'd be happy to jump in first. I would remind everybody about the 3 W's. Don't forget those 3 W's. They are really essential to all of us making it through this, right? So wearing your mask, waiting 6 feet apart, and washing your hands. Sometimes I think, gosh, you know, isn't it great that we have some very basic things that are accessible that we can do to stay safe? And we can't overemphasize how much these 3 things, the 3 W's, can really take us a long way to keep us safe, especially as we consider how to be safe at school, wearing the mask, especially for us as the adults, setting an example, using positive language around the children, doing all those things all of you do well, you know, hey, we're going to wear a superhero mask to keep us all safe. Isn't it great? We have the superhero tool to fight the COVID virus or the COVID disease. So framing it in that way and in role modeling for the children, the 3 W's can have a really powerful effect.
Excellent. And a question came in about recess, because I know, you know, there have been conversations around, should kids, you know, do they have to wear a mask when they're out at recess? And when is it safe to be able to, and how should students be allowed to take mask breaks?
Yeah, I can try and address that. So I've also honestly been impressed by the creativity schools have put into play around creating safe spaces for kids. So anyone that's worn a mask all day, I think most people should be doing it, and most of us are doing it. I'm still at work right now. We wear a mask all day in here. It can get tiring. So having a safe space, preferably outdoors, to take the mask off briefly and setting bookends, a beginning and end to that mask break, so everyone knows what that period is and when it's over, is one option. It's just one way to make this a little bit easier as we go into in-person education. You talked a lot about how the plans around lunch, important to ensure that lunch does not become a means of spread where it defeats the purpose of everything you've done all day. So limiting eating, so unmasked periods to short defined times would be helpful. And as much as possible, I think learning from the kids, I think I see kids in the hospital every day, and they tell us how they make their mask work for them and where they have to put it and how they put on their headbands and things like that. So allowing the kids to direct efforts, but ensuring that the key protocols are in place, which is you do have to keep your mask on, particularly when you're coming in close contact or you're indoors with people that are not in your household. I wonder if some of my other colleagues have some suggestions around recess and lunch.
I think that was perfect.
And I think we have time for one more. And actually, you know, this has been a recent topic of conversation for us here in Orange County Schools with our families, about being able to rehearse for, you know, band and chorus indoors. And, you know, where we're at right now is that based on guidance from Orange County Health Department and the ABC Science Collaborative, that at this juncture, we are not encouraging indoor rehearsal, that if there's going to be any, that it needs to be outdoors. Could you help us to understand a little bit better why that it's not safe yet to rehearse indoors?
Yes, I'll try and keep it brief. And we've tried to come up with some additional resources. I know we can't get through everything in the brief period we have here, but we do know that one way to increase the amount of droplets or ways to spread viruses in the air is by shouting and singing. And as much as going back to the Swiss cheese model, as much as we want to ensure that all of our practices are working all the time,
Hello, teacher.
it's probably best to remove one factor if you can. And so in this case, I think people are doing their best to stay masked even while singing. We know you're going to release more droplets, so if you can do it outdoors, it's probably a good idea. As we get more data around what happens in schools, what happens around choir, what happens with bands, particularly with younger kids, I think both the state, the CDC, and locally, we can share that data, and I hope it would inform additional school policy changes in the next few weeks to months.
Excellent. Well, Dr. Merdiaga and Dr. Ekamboyo and Dr.
Hello,
Zimmerman,
teacher.
we thank you so much
Hello.
for giving us some of your time out of your busy schedule. We truly appreciate your expertise and your guidance, because of course this is, you know, like our area is education, and we've got that down. But when it comes to the science around COVID, that is not our area of expertise. And so we truly appreciate your guidance and your expertise, your time. And families, we thank you for your time and your partnership in ensuring that our students and our staff are safe as we plan to prepare for Plan B transition starting in January. We are going to capture all of the questions that you have submitted. We will create an FAQ for you and share this recording as well as the questions and answers with you on the website. And please submit your Plan B sign up to let us know how you would like to return back to school, and that is due by November 23rd. If you're struggling to know what to do and what you should decide for your child, please reach out to your schools. Your principal and teachers are more than happy to talk to you about the different options and what's in the best interest of your child. Please know, on behalf of Dr. Felder and all of the staff at Orange County Schools, your safety is of utmost importance to us, but also we are very concerned about and making the best decision for your overall development of the whole child. And so we are working to bring your children back to school in person.
Hello, teacher.
So thank you so much and have a great evening.
I think Mr. Carlos has a question, and he speaks Korean, and I don't know if we have the interpreter for Korean that can help us interpret what he wants to ask.
For Corinne?
Yes.
Yeah.
Ms. Stowe, is our Corinne interpreter available?
Yeah, but I didn't hear no clean. I don't understand. She talking because, you know.
Can the Korean interpreter help us?
If you wouldn't mind giving us the question in the chat, and then we'll be sure to follow up.
I think that we don't have the
alphabet,
the alphabet for yes. So that's one of the barriers.
Okay.
So let me see if we can.
Could we put a phone number in the chat that they could call?
Okay.
So that we can follow up with them?
Yeah, okay, yeah, okay.
Okay?
Yeah.
Okay, please call us and we'll call you back.
Yeah. Let me put my
okay.
number.
Do you know my number?
No, I'm gonna put my number and my email. I'm gonna send you my email. How about that?
And Ms. Blefko, if you could also please include the phone number in case they don't have email access readily available.
You call me phone number, right? Hello?
Yes, they're going to, if you look in chat, Ms. Blefko, if you could please give the phone number.
Okay, so I had to, they already know my number? Or I had to give them a number?
We need you to telephone this number. Call this number.
You send me a message. That's my email and my number. And we will reach you.
So we send my number right now?
Don't send the number in the chat, please.
No. There's a number. We
Just
gave you
look at my
number.
number. Yeah,
Okay. Thank you.
thank you.
Have a good evening, everyone. And Mr. John, we will get you answers to your question about the cleaning and sanitizing process in the FAQ.
Okay, you call me
Okay.
number, right? You say.
Thank you. And
Yes.
Mr. Jones, if we could stop the meeting now, please.